de la pandemia de coronavirus 2019. Hoy queremos comentar varias cosas con ustedes, además del informe diario en el que hemos agregado algunas.
Today we will be talking about a number of things.
Que comentaremos.
On top of the daily technical report, we will also be discussing the measures, information regarding the measures that are aimed at reducing the social mobility within the public space and the results so far. We have information that has been shared with us by the Mexico City government. We have Dr. Ricardo Cortés Alcalá, who was the creator of the Susana Distancia character that has been used to promote the healthy distance protocol. And he will be talking about the technical documents that we have been creating during the last couple of months. And one of our most important interests is that the people the public in general, but also the people who work within the health sector, know that these technical documents do exist and they are available for everyone who wants to consult them. They are academic documents, but they can be given a general use under a set of circumstances. We're also waiting for Dr. Santos Preciado, who will be talking about the cooperation between the private and public sector amidst this crisis. Thank you. Let's begin with the technical daily report. You all are all familiarized by now with this first graphic, which is the world situation with data from the World Health Organization. We can see the proportion of cases has been decreasing during the past 14 days. We have a decrease to 71% cases. So during the past 14 days, there are less active cases than before, but 71% is still an important percentage. The global lethality rate is increasing, although it is increasing little by little, but it has continued an upwards trend. It is currently at 5.7. And if we look at the more specific data regarding the past 24 hours, we can see how the European region and the Americas have virtually the same percentages. They have 45, 46%. So we basically reached the same level during the past 24 hours. Here we can look at the national situation. We have 2,785 cases confirmed so far, a little bit more than 200 new cases confirmed in the past 24 hours. And we've reached, unfortunately, 141 fatalities so far. We've studied a total amount of 25,400 cases. Here we can look at the distribution per state, and we can also look directly at the accumulated incidence rate. From now on, we're going to be jumping straight to this chart because it is more informative in the sense that it shows us the amount of infected cases, but it also shows us the accumulated incidence rate, which is taking into account each state population. So we regard this chart to be more complete, and we will be jumping to it directly from now on. This is the age group distribution associated to the relation between inpatients and outpatients. We can see how now patients over 65 years old have surpassed in proportion, the inpatients have surpassed the proportion of the outpatients for the over 65-year-old age group. The yellow bars represent patients that show severe symptoms and are in the need to be hospitalized. In this chart, we can look at the distribution regarding these 140 deaths. The blue bars are the number of fatalities per state, and the green line is the lethality rate per state. We will be jumping straight to this chart from now on, because we can look at both data at the same time. And the order, the states appear in order from highest lethality rate to lowest lethality rate. Now we can look at the comorbidity chart, in which we can continue to see the phenomenon that most of the people who have died because of this virus have presented pre-existing conditions such as hypertension, diabetes, obesity, or any of these conditions that are presented on the chart. And please, if you do have any of these conditions or belong to a vulnerable age group, take special precaution and please abide by the isolation measures, because during the upcoming weeks we will see a constant increase in the number of daily confirmed cases. Finally, we can look at this chart, which has the epidemical curve and the number of newly confirmed daily cases. So we continue to exhibit an upwards trend, and that would be my report for today. Thank you, Dr. Salomia. Dr. Ricardo Cortés Alcalá now has the floor, and he will be sharing with us some very important information. So you can see the developments in the response, in the federal response to this pandemic as the pandemic evolved, because we have been changing and modifying and amplifying our strategy. Doctor, please. Thank you. Thank you very much for being here. Good evening to everyone. These guidelines and protocols that we've been working on collectively at the General Direction for the Promotion of Health, in collaboration with several federal level and local level institutions from the health sector and the tourism sector. These protocols and guidelines have involved a wide array of topics, and they started to be created way before we had our first case, so we've been working on them for a while. We have, for example, the laboratory guidelines and protocols regarding COVID-19. This was the first set of guidelines that we created from the epidemiological laboratory, and we've been updating and modifying these guidelines to make them more complete and more efficient, and they can be downloaded at the official website. And they are constantly being updated on that website as well. Another important program is the hospital reconversion program, which has been discussed in several press conferences before. And this program, this set of guidelines basically aim at stating what are the conditions that should be met by each of the medical units within the country in order to be properly prepared for dealing with the increased amount of patients overall and also COVID-related patients that they will see in the future. This involves such measures as reconverting some procedures and some physical equipment in order to expand the treatment capacities. Here we have a set of guidelines, which is the guidelines and protocols for treating patients infected with COVID-19, and they basically cover all the detailed information regarding how to best treat such patients, and they have been updated constantly, taking into account the development of the pandemic and the latest recommendations by international institutions all over the world. We also have the set of guidelines for handling dead bodies or cadavers, and they of course involve all the best practices to handle dead bodies and to be completely safe while doing so. This is of course necessary, even though we had previous protocols and previous guidelines that are basically the same for the case of influenza, for example, and we had those protocols previously, but we still updated them and made sure they were correct. Here we have the protocol for the prevention of disease and infection regarding COVID-19. These are the measures that should be taken by medical staff for handling infected patients. These are also important regulations and guidelines because one of the most vulnerable groups is the health personnel in general. So they should have all the information to be protected when carrying out their duties. Next one is the acting protocol for COVID-19 inside social correction centers, inside prisons. This protocol has been a joint effort by the Ministry of Health, the Ministry of Security, and basically covers what measures should be taken when dealing with people who have been deprived from their liberty because of judicial reasons, so people who are inmates, people who are in prison, specifically regarding COVID-19. These are also important guidelines. These are general guidelines for the prevention and mitigation of COVID-19 in enclosed spaces, public spaces, and open public spaces as well. This is a set of guidelines that should be applied in enclosed public spaces that are still operating, such as markets and supermarkets, and they include the safe distance that should be kept between individuals, the protocols for visiting such places, and of course they also include public spaces that are open, for example, beaches, resorts, hotels that they are of course right now closed. All of them have suspended activities, but when they go back to work and when they reopen and start operation, these guidelines will come in very handy. Last set of guidelines that I would like to present to you is the guidelines and protocols for the best practices within child care facilities regarding the COVID-19 pandemic. They of course cover some particular information regarding child care facilities that should be given special attention in order to prevent children from getting infected. And they are of course available online as well. Finally, the last set of protocols that you can also see in this slide to the right is the tourism sector protocol for the best practices that should be adopted within hotels specifically, because there is an important amount of tourists that are stuck at different hotels in the country that have not had the opportunity of going back to their countries because of a variety of reasons, either because their flights got cancelled or because their home countries closed their borders and they are stuck at such hotels. So this protocol establishes that these hotels, for humanitarian reasons, in spite of tourism not being an essential activity for the economy as declared by the sanitary emergency agreements, but because of humanitarian reasons, these hotels should continue to provide services to these stuck tourists, and they should follow these guidelines to do so. Thank you very much. Now, Dr. José Santos Preciado, who is the Secretary of the General Health Council, and he's also a wide-renowned epidemiologist, and he's been a consultant for the World Health Organization for several years. Dr. Santos will be sharing with us some information about the collaboration between the Health General Council and the private sector institutions, and what this means to the expansion of our treatment capabilities. Doctor, please. Thank you, Deputy Secretary, and thank you for the opportunity of sharing with us the hospital conversion plan for COVID-19. This alliance is the collaboration between some public and private hospitals. We have two very important associations, which is the Association of Private Hospitals and the Council of Private Hospitals. These entities have established communication with the General Health Council because we are the authority in the public health sector, and we are the one who certify the different processes and different certificates within private hospitals as well. So we have recognized that we have over 30,000 beds in private hospitals that have a over 30% occupation rate. So they could come in as a very useful resource. We need extra beds. Now, these different associations that include different states in Mexico overall cover 250 hospitals that have the ability and the capacity to collaborate with the public sector should they be needed to for dealing with the COVID-19 pandemic. So the plan goes like this. First, we have the respiratory triage stage, also hospital structure, non-essential services, personal protection equipment. These are all services that the private sector hospitals could be collaborating with in the public sector, given the case that they would be required. Tomorrow we will be presenting more detailed information about this, but Just to give you an overall look, if we compare these two important associations, we are talking about 146 hospitals, out of which we have 124 who are available. We're talking about over 6,000 beds that they could be converted to 1,000. They could provide 1,106 COVID-19 special beds, designated beds. Here we can look at a list of some details regarding the operations and the services that they could facilitate to us. The total number of beds that could be available, the total number of beds that could be expanded, the total number of the total number of patients that could be provided treatment as well. So we're talking about more than 5,000 beds, more than 500 emergency treatment units, and the possibility of expanding such services to an amount of 1,200 beds. So this alliance plan basically is an initiative that seeks to expand the capacities of our public overall health sector in order to deal with this pandemic, with the collaboration of private hospitals and the public sector. This alliance plan has been distributed to all private hospitals within the country, and it includes an emergency case scenario protocol as well. All of these hospitals that are contemplated in this plan have been certified, and they have an ethics committee for hard decisions. So this is a really great effort that the private health sector is displaying in order to provide their support to the national health sector. Of course, this is a previous plan, but it is precisely because of that we have created it, because we want to be prepared for any scenario. This is the information that I will be presenting so far, and there will be more information available through the portals of the Ministry of Health and to the Ministry of Health. The strategy will be coordinated by representatives of the public and private sector, and they will be making the decision of whether and when it's suitable to launch this collaboration. Thank you. As you can see, from the very beginning, the government decided to work with all sectors. That is why we have been saying that this is a state response, because when we are dealing with such a complex phenomenon like the one we're dealing with, everyone has a role to play. And it is the role of the government to organize in an effective way each sector's participation. For the most part, the private sector has been responsive, has been willing to collaborate, both in the dimension of direct medical treatment and also in other dimensions that don't have anything to do with medical treatment but are also involved within this process. We have insisted on recognizing the labor and the help of all of those highly responsible businesses, small businesses, medium businesses, large businesses, that have been acting take into account the public interest and the collective interest, because they are helping us all. There are still some companies, though, and some businesses that seem to be focusing on other motivations and that are not quite on the same page as the rest of society. They are not taking seriously all of these measures. We have said that these measures will have a negative impact on the economy, but it is absolutely necessary to implement them. So all of those companies and those businesses and those actors who may be talking about we shouldn't be stopping activities, we shouldn't be taking these measures that seriously, we should be still on the street, it seems like they have not been paying attention, because we are implementing all these measures right now in order to see a positive effect several weeks from now. So we would like to make a call again to all of those companies and also private individuals and people in general who haven't been paying attention and haven't understood what the measures are about. Please do inform yourselves. There are other channels for information, but it is important that you understand what is the meaning behind these measures and what is the importance behind these measures. Now let's talk about mobility rates in Mexico City. This is part of the technical evidence that we are basing the design of our protocols in. The governor of Mexico City, Claudia Sheinbaum, has shared with us this information and these graphs, and also the Secretary of Mobility of Mexico City has shared with us this information. This is very useful information because here we can look at the daily monitoring that Mexico City carries out of public transportation, subway, metrobus, Mexicable, light train, eco-bikes. All the main public transportation means within Mexico City are covered here, and the graphs can be interpreted in this way. We can see the dot line that is zero variation, and anything below that line, that's a variation in mobility. So we can see that on average we have a 60 to 65% of decrease in mobility. For the case of bikes, it's been almost 70%. So this is good news. And we would like to thank the support and the cooperation of all the people who have contributed to reducing this mobility index, because these are all citizens that a lot of them have to use public transportation, and they have been making a sacrifice in order to help society overall. So in this manner, we would also like to see those companies that haven't been acting in a similar way. There are some big companies that have been very slow in their response. They're looking for a way out of these suspension of activities, and they're looking for a loophole or a way to continue to operate. And we want to ask for your understanding, and please understand that this is not the moment for focusing on profit. This is the moment to join society in their collective effort of stopping this pandemic. If we don't pay attention to this, if because of some economic interest we delay the desired effect of workers having the possibility of staying at home, then that's gonna affect negatively all of us, all of the sectors. I want to say this very clearly because we've seen some entrepreneurs and business owners who have been very cooperative, but some of them haven't. Here we can look at a different group. This is the private vehicle mobility variation. These are all the people who do not use public transportation, but they have their own cars and their own vehicles to transport themselves through the city. This data is from these three different colors correspond to three different periods of time, 3 different weeks. The gray shadow is the intensity is the normal intensity of private vehicle mobility in Mexico City. And look at how impressive it is, the variation, the decrease that we've had in mobility. Again, I would like to thank all of the citizens who have stopped using their private vehicles, and they have contributed to this decrease in mobility in Mexico City. Let's continue with the question section. Thank you, Doctor. I would like to know about the plane that is scheduled to be landing in Mexico at 9 p.m. What supplies is this plane bringing to us specifically? And is that the only purchase that the government will make? Do you have any more purchases on the way? Also, I would like to ask you about this resolution that Mexico created in the context of the United Nations when the Mexican state stated that we do have enough supplies. Yes, first of all, the first question. Last Saturday, there was a plane that we rented. Well, it was facilitated by Aeroméxico. This plane went to China with some public officers of the Ministry of Foreign Affairs, and they had a very clear mission that was to acquire all the supplies that our government bought from several weeks ago. This has been a very important process, and I would like to thank the collaboration of the Secretary of Foreign Affairs and all of his team, because they have been carrying out a recognition mission all over the country to know which supplies are a necessity, and they made the relevant purchases. So we have N95 masks coming, we have gloves coming, we have all sorts of medical protection equipment coming. I will not be giving you specific amounts because there will be a press conference specifically for that, but I can tell you this. This will allow us to cover 100% of the needs of personal protection equipment for the medical units within the national health system. This morning we presented specifically information about the ventilators, but the personal protection equipment is the one that is coming on the plane. This is not the only flight that is going to be bringing equipment. We have established an air bridge, so to speak, which means that there's been a communication channel has been established between Mexico and China, and we will be bringing more specialized equipment in the short future. So far, we only have purchased this equipment, most of it from China, and of course we will continue to explore different markets and different offerings. We have carried out a very extensive exploration operation, but as you know, the European Union is currently experiencing great difficulty when it comes to providing enough supplies even for themselves. So nowadays, the country that has enough supply is China. How did you test the quality? This question was asked about 4 or 6 days ago, and we talked about it. Everything that we buy has to undergo a technical revision. We have a technical team, and thank you, David Leon, who is the coordinator of civil protection. He has been incredibly effective in facilitating the communication between different government institutions that are working together to this end. This operative command or this technical team have sub-teams and sub-units that are in charge of specific roles. For example, we have had specialists from the Nutrition National Institute that has been handling all the different lists of which supplies we actually need, which ones we don't, which ones are appropriate to use, and which ones are meeting the quality standards. Could you give us an approximate number of the amount of pieces and supplies? If I give you a number right now, and then this information differs from the official press release, then you're going to say that I gave you incorrect information, so I won't for now. I can tell you that the protocol defines that the state secretaries within the tourist sector and the local level tourism authorities are going to be implementing a communication process to know which hotels have been closed, which hotels still have tourists, and how to implement this protocol, this safety protocol for these people, and to monitor suspect cases of COVID, and those tourists that are no suspect cases, they're only waiting to return home. So I will be communicating with the tourists, with the Ministry of Tourism, and we will be providing this information on a daily basis. So far, we don't have an official list because we are still in the redistribution phase of the strategy, and this is the work of the tourist associations locally and the local governments as well. Thank you very much. I want to ask you, we have 6 students from the National Polytechnic Institute and from the Georgia Technological Institute who are creating prototypes of ventilators. They're here in Mexico, and I want to know if the government is going to reach them, because we interviewed them and they told us that these prototypes, once they are finished, which will be next Friday, they will cost between 2,500 and 3,000 pesos. Thank you. We have evaluated multiple prototypes, and thank you to all of the organizations, citizen organizations, and also small enterprises and small academic groups that have been sending us various proposals. Not all of the proposals are suitable or feasible. The process of manufacturing of these devices, given their medical use, need to meet the highest industrial safety standards and also very detailed technical specifications. So out of all the different prototypes that we've been presented, we have had a technical group that coordinates, and this group involves staff from the Ministry of Economics, from the National Institute of Nutrition and Medical Science, and of course also staff from the Ministry of Health, and of course some engineers from the National Polytechnic Institute, from National Autonomous University. So it is a very diverse team. They've been carrying out very technical research. They've been doing very detailed evaluations through a artificial lung-based virtual model that allows them to be very detailed in their evaluation processes. We have the simulators for doing so. The Navy has also simulators and this kind of equipment. And out of all of these joint efforts, we have decided the prototypes that are suitable. We've also had the cooperation of CONACYT, the Commission for the Advancement of Science. We've had particularly the support from a center, a CONACYT center in Querétaro. So we are advancing on this front. We are moving forward. We don't have specific information to share which prototypes we're going to be using, but we are definitely taking care of it. Thank you. I have 3 questions. First of all, Dr. Cortez, talking about something we were talking about last week, do you have protocols so far for places such as migrant stations, for example? And talking about prisons, have we had confirmed cases of COVID within prisons? Also, what is the incidence rate? What are the plans in order regarding the relatives of those deceased patients for making post-mortem studies and providing safety measures for those relatives of those patients that have lost their lives? Also, could you talk about the contagions the cases of infected patients that do not show any symptoms? Could you talk about that? I will talk about this first. This is something that we've been repeating. We will answer again, and I talked about this morning, about this very same topic, but I will say it again, it doesn't matter. This is a new virus, so the information is changing all the time. We still don't have absolute or definite information regarding different dynamics related to the virus. One of the important parameters is the incubation period, which is the duration that goes from the probable infection to the appearance of symptoms. And then after the symptoms are displayed, there is an active disease period, and then we have a contagion period. Typically, a very large proportion of infectious diseases, we have first the symptoms, and then basically at the same time, we have the contagion stage. But there are some multiple infectious diseases in which we have the possibility of contagion a few days before any symptoms are displayed. What is the explanation? In this case, the virus is replicating within the respiratory system of patients. And in the act of replicating, the virus liberates virus particles in the respiratory secretions. Even if the burden, even if the virus presence is not important enough in the patient yet in order for him to start to exhibit symptoms and creating antibodies, it is possible that the virus is already at the position of creating contagion. So it is possible to have contagion in the pre-symptom stage, or for the symptoms to be so mild that there are people who are propagating the virus, but they are not aware that they are infected with the virus. So both scenarios are possible. What we don't know so far in quantitative terms is how important this phenomenon is. We have a protocol, a research protocol that has been proposed to research to investigate this phenomenon, but we don't have any conclusive numbers yet. Talking about the accumulated incidence rate, we have 2.7 average incidence rate, 2.7 per 100,000 inhabitants. The attack rate is usually calculated comparing the totality of the population, the whole population, which is basically the whole population of Mexico. So for the attack rate, the attack rate would be very low so far. It would be 0.0000 something, because we have 129 million people, and we still have very few cases compared to the whole population. Talking about the fatalities, yes, the Center of Epidemiological Vigilance collects samples from the dead bodies, and then they study them at the lab. Usually they do this within the hospital, when they enter the hospital, but if they have no opportunity and they need to take the sample, they can do it after the person dies. And these studies are usually carried out in order to know, the post-mortem studies undergo to know, to establish things like, in Mexico, can we say that effectively the infected cases were 70, 80, or 90%? So this information that you were requesting is still early to talk about this information, because we have not enough data to carry out the proper estimations yet. But all of the tests that we have carried out and all of the positive tests have been included in the statistic. Thank you. I would like to say that regarding the possible cases of patients that do not exhibit any symptoms but are infected with the virus and they could be contagion people, well, that is exactly why the safe distancing protocol is very important, because if I'm talking to someone who has been infected and we don't know, if we are 1.5 meters away, it doesn't matter that I'm talking to him, because I will not get infected by him. And regarding the migration centers that you were talking about, these migration centers are abiding by the general enclosed public spaces regulations that currently exist, and they have protocols to deal with the risk of infection and to create safe distancing between people. And they know the specific protocols to communicate and to reach the health authorities in the region, given the case that they would find someone who has tested positive for COVID-19. So far, we don't know of any positive cases, confirmed cases of COVID-19 in migration centers or in prisons. Yes, first of all, I would like to know if you have a registry of the Mexicans that are living abroad and that have died abroad. We were hearing that in New York there are over 100 Mexican people that have died. Also, do we have any protocols to repatriate, to retrieve the bodies to the national territory? Yes, we do have protocols to recover the bodies. They are included in the guidelines for the treatment, for the handling of dead bodies. The National Epidemiological Vigilance System gathers information specifically from the cases that have been detected and reported within the national territory. we have been some reports, we have seen some reports from other entities that have to do with Mexicans who have been infected abroad, but this is not something that is included in the report or the statistic because we are dealing with the data of what happens within the country. It is possible that there have been some Mexicans that have died overseas or abroad as a result of COVID-19, but so far we don't have confirmation for this because we have not the specific data. Doctor, there is huge concern in the IMSS hospitals because specifically from the hospitals where they are from which they are sending the test to Mexico City, because they are having to wait for 5 or more days in order to get a result. Some patients have died before getting the result. So are all the tests that are being applied in the Mexican territory being sent to Mexico City? And what is the response time? Yes, we have known about this for 48 hours. This piece of news has been circulating for 48 hours. Let me tell you what's happening. Currently in our country we are experiencing difficulties regarding the airline industry, meaning that we don't have enough flights. In order to take the test from one point to the other, we need an aircraft. And usually it would be a very efficient process, but because of the lack of sufficient aircrafts, it becomes an inefficient process. So we address the situation. I have informed of this. I informed of this situation to Dr. Robledo, who is the general director of the IMSS hospital. We worked with different organizations, and we had a technical meeting yesterday, and we analyzed the best ways to have a more efficient route. The 31 states of Mexico and Mexico City, they have a federal public health laboratory, and that laboratory or those laboratories could be used to implement this test. The supplies for the test are supplied by the INDRE. So we are about to reach an agreement and sign an agreement that will allow for the states, for the different states, to examine the test within their local laboratories, and this will solve the problem. We have 3 minutes. Yes, my question would be, what is the deficit, the doctor deficit so far? If last year there was a 94,000 doctor deficit, so how many are we lacking so far? In order to face this crisis. We've been talking about this for months. I have presented this information myself on the daily conferences, and we've been talking about this deficit that Mexico has had for many decades. We've had several reports of international institutions that indicate that we have a severe lack of health sector professionals, as well as medical equipment. So, if you could just look at the information that we have been presenting, all of the data is there. How many patients have recovered? The last statistic, and this is being updated every day because we have new cases coming every day, but the percentage we have of recovered cases so far to this day is being 42 to 45%, which is cases that have more than 14 days since they started exhibiting symptoms. Talking about the agreement that was published in the Federal Official Gazette, when they said they would restart operations in those sectors that are related to federal projects, such as the Santa Lucia Airport and the refinery in the south. Do you think this is a proper measurement right now amidst this crisis? We have the possibility right now of using these government projects, infrastructure projects, because they are federal government regulated projects. We have a very strict control, and this allows us to confirm and to make sure that the health distance protocols and all other protocols are being implemented. So that's why we decided to restart this project. Also, we have a report that says that the metal industry and the cement industry equipment have two characteristics that are very important. First of all, these melting devices and this infrastructure, they cannot be stopped, because if they are stopped, they would have very negative effects. Also, today's technology allows us to operate this equipment with very few personnel. So if you look at the guidelines, you'll see that the companies that will be restarting these operations will be compelled to inform the Ministry of Health how many workers will be working, what is the essential worker list, and what is the reduction that they are implementing. So there is no risk. So the president decided that the works wouldn't stop, and that's why you had to the president asked you to not stop these works? No one had to ask anything from me. We've been analyzing all of this information in technical commissions, and all the information is on the official Federal Gazette. It's only three major works of infrastructure. But we have statistics, the infected rate and the mortality rate per age group. I think there are more people who are over 65 years old, but the infected cases are between 35 and 60. I'm not too clear on the data. Yeah, we will prepare the information for you and we'll present it. Thank you. Just a reminder, we are not on holiday. We are not on a vacation period. What formerly was known to be the vacation period would be starting under different circumstances, but vacations have been cancelled. We are not on holiday. We haven't achieved to flatten the curve or to slow down the rate. The rate continues to present an upward trend. So I would like to call all of those companies and those organizations that have not provided sufficient conditions for workers to stop going to work in person. Thank you very much.